Question number 1. Which vaccine is stored in the freezer? Option A DPT, option B tetanus toxoid, option C measles vaccine, option D hepatitis B vaccine. Let's see answer friends. Correct answer is option C measles vaccine. Measles vaccine and oral polio vaccines are highly sensitive to heat, requiring storage in freezer. Question number 2. In preparing a primigravida for breastfeeding, which of the following will you do? Option A tell her that lactation begins within a day after delivery. Option B teach her nipple stretching exercise if her nipples are everted. Option C instruct her to wash her nipples before and after each breastfeeding. Option D explain to her that putting the baby to breast will lessen blood loss after delivery. Correct answer is option D. Explain to her that putting the baby to breast will lessen blood loss after delivery. Suckling of the nipple stimulates the release of oxytocin by the posterior pituitary gland, which causes uterine contraction. Lactation begins 1 to 3 days after delivery. Nipple stretching exercises are done when the nipples are flat or inverted. Frequent washing dries up the nipples, making them prone to formation of fissures. Question number 3. You are in a client's home to attend to a delivery. Which of the following will you do first? Option A set up a sterile area. Option B put on a clean gown and apron. Option C cleanse the client vulva with soap and water. Option D note the interval, duration and intensity of labor and contraction. Correct answer is option D. Note the interval, duration and intensity of labor and contraction while you are at home to attend a delivery. Assessment of the woman should be done first to determine whether she is having true labor and if so what stage of labor she is in. Question number 4. Inadequate intake by the pregnant woman of which vitamin may cause neural tube defect? Option A niacin, option B riboflavin, option C folic acid, option D thiamine. Correct answer is option C folic acid. It is estimated that the incidence of neural tube defects can be reduced drastically in pregnant women have an adequate intake of folic acid. Question number 5. A pregnant woman had just received her 4th dose of tetanus toxoid. Subsequently, her baby will have protection against tetanus for how long? Option A 1 year, option B 3 years, option C 10 years, option D lifetime. Correct answer is option A 1 year. The baby will have passive natural immunity by placental transfer of antibodies. The mother will have active artificial immunity lasting for about 10 years. A 5 doses will give the mother lifetime protection. Question number 6. You will not give DPT 2 if the mother says that the infant had option A seizures a day after DPT 1, option B fever for 3 days after DPT 1, option C abscess formation after DPT 1, option D local tenderness for 3 days after DPT 1. Correct answer is option A seizures a day after DPT 1. Seizures within 3 days after administration of DPT is an indication of hypersensitivity to pertussis vaccine, a component of DPT. This is considered a specific contraindication to subsequent dosage of DPT. Question number 7. A 4-week-old baby was brought to health center for his first immunization. Which can be given to him? Option A DPT 1, option B OPV 1, option C infant BCG, option D hepatitis B vaccine. Correct answer is option C infant BCG. Infant BCG may be given at birth. All the other immunization mentioned can be given at 6 weeks of age. Question number 8. Which immunization produces a permanent scar? Option A DPT, option B BCG, option C measles vaccines, option D hepatitis B vaccination. Correct answer is option B BCG. BCG causes the formation of superficial abscesses which begin 2 weeks after immunization. The abscess heals without treatment with the formation of a permanent scar. Question number 9. The major sign of iron deficiency anemia is a pallor. What part is best examined for pallor? Option A, palms. Option B, nail beds. Option C, around the nail lips. Option D, lower conjunctival sacs. Correct answer is option F, palms. The anatomic characteristics of palms allow a reliable and convenient basis for examination for pallor. Question number 10. To prevent xerophthalmia, young children are given retinol capsule or solution every 6 months. What is the dose given to preschoolers? Option A, 10,000 international unit. Option B, 20,000 international unit. Option C, 1 lakh international unit. Option D, 2 lakh international unit. Let's see answer, friends. Correct answer is option D, 2 lakh international unit. Preschoolers are given retinol 2 lakh international unit every 6 months. 1 lakh international unit is given once to infant aged 6 to 12 months. The dose for postnatal women is 1 lakh international unit. Diagnosis of leprosy is highly dependent on recognition of symptoms. Which of the following is an early sign of leprosy? Option A, macular lesions. Option B, inability to close eyelids. Option C, thickened painful nerves. Option D, sinking of nose bridge. Correct answer is option C, thickened painful nerve. The lesions of leprosy is not macular. It is characterized by a change in skin color, either reddish or whitish, and loss of sensation, sweating, and hair growth over the lesions. Inability to close the eyelids, also called legophthalmos, and sinking of the nose bridge are late symptoms. Question number 12. Which clients are considered targets for DOTS category? Option A, sputum negative cavitary cases. Option B, clients returning after default. Option C, relapses and failure of previous pulmonary tuberculosis treatment regimen. Option D, clients diagnosed for first time through a positive sputum examination. Correct answer is option D, clients diagnosed for the first time through a positive sputum examination. Category 1 is for new client diagnosed by sputum examination and client diagnosed to have a serious form of extrapulmonary tuberculosis such as TB, osteomyelitis. Question number 13. Which of the following signs indicate the need for sputum examination for AFB? Option A, hematemesis. Option B, fever for 1 week. Option C, cough for 3 weeks. Option D, chest pain for 1 week. Correct answer is option C, cough for 3 weeks. A client is considered a pulmonary tuberculosis suspect when he has cough for 2 weeks or more, pulse 1 plus 1 or more of the following signs: fever for 1 month or more, chest pain lasting for 2 weeks or more not attributed to other condition, progressive unexplained weight loss, night sweats, and hemoptysis also common symptoms of pulmonary tuberculosis. Scotch tape swab is done to check for which intestinal parasite? Option A, Scariasis. Option C, pinworm. Option C, hookworm. Option D, cystosoma. Correct answer is option B, pinworm. Scotch tape swab is done to check intestinal parasite pinworm. Pinworm ova are deposited around the anal orifice. Question number 15. Secondary prevention for malaria includes option A, planting of neem or eucalyptus trees. Option B, residual spraying of insecticides at night. Option C, determining whether a place is endemic or not. Option D, growing larvae, eating fish in mosquito breeding places. Correct answer is option C, determining whether a place is endemic or not. This is diagnostic and therefore for secondary level prevention. The other choices are for primary prevention. Question number 16. The pathognomonic sign of measles is Koplik spot. You may see Koplik spot by inspecting the option A nasal mucosa, option B buccal mucosa, option C skin or on the abdomen, option D skin on the antecubital surface. Correct answer is option B buccal mucosa. Koplik spots inspect at the buccal mucosa. Koplik spot may be seen on the mucosa of the mouth or the throat. Question number 17. A client was diagnosed as having dengue fever. If the color of the nail bed that you pressed does not return within how many seconds? Option A 3 seconds, option B 5 seconds, option C 8 seconds, option D 10 seconds. Let's see answer, friends. Correct answer is option A 3 seconds. Adequate blood supply to the area allow the return of color of the nail bed within 3 seconds. Question number 18. Which vaccine should not be stored in freezer? Option A DPT, option B OPV, option C measles vaccine, option D MMR vaccine. Let's see answer, friends. Correct answer is option A DPT. DPT is sensitive to freezing. The appropriate storage temperature for DPT is 2 to 8 degrees centigrade only. OPV and measles vaccines are highly sensitive to heat and require freezing, that is temperature minus 20 degree centigrade. So friends, that was very important questions for upcoming exams. Please also save our previous 11 test videos and other nursing officer and staff nurse preparation videos also. Also like, share and subscribe our channel. Practice test number 30 will coming up next. So please also see practice test number 13 coming up. Thanks for watching.